At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Brain Fog and Memory Loss on Wednesday, February 14th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
This is Dr. Tom Roselle Live on 105.9 FM WMAL.
Hi, everybody. Dr. Tom Roselle here. Got a lot of interesting news and information for you. It's going to lead into our program on February the 14th. And it's going to be at the Roselle Center for Healing in Fairfax. And you know how to find that. You can go to either drtomroselle.com or go to rosellecare.com and register. But this program is one that brings a lot of interest for all of us. And what I'm talking about is how your brain works, or some cases doesn't work very well. We're going to be talking about dementia and memory loss and brain fog and things of that nature. It's an important subject because so many of us in today's world are suffering from it, and it starts out way too early. And there's reasons for that. I'm going to go over that with you step by step on Wednesday evening. But more importantly, I want to talk about a little unknown situation today that might really get our attention. Many conditions of memory loss start out with protracted stress patterns over a period of many years. And sometimes, we know that injury will do it, right? Blows and traumas and so forth, and exposures to environmental things and heavy metals and toxins and so forth. But stress also will do it. And sometimes, we live with stress, so we don't even know that we have the stress pattern. And we want to make sure that, we really understand that health is a do-it-yourself program. It's a kind of, the name of my book. Remember that? But more importantly, that this condition often is a do-it-yourself situation because of neglect often, and because of the unknowingness of what to do about it and how to stop ourselves from going through that process. Oh my God, this, the sky is falling, the Chicken Little, situation. And particularly in today's world, every time you turn on radio, every time you turn on a television station or live stream or anything of that nature, everybody's talking about, the world is coming to an end. And we imbue that, we chew on it, we think about it, and pretty soon we don't even realize that stress levels build up. But it's burning up a lot of different amino acids and neurotransmitters and causing, evoking a response in our fight-flight system. And our primary target there is the adrenal system, the little glands that sit on top of your kidneys and put out all kinds of things. So you have several layers of that adrenal gland that sits on top of your kidneys. It's a ductless gland. It squeezes its hormones into the blood, just like a sponge squeezing, its liquid, whatever it's soaked up into, whatever you're going to squeeze it into. But in this particular situation, your center portion of the adrenal glands is one of the things that we're really looking at, and it's called the adrenal medulla. And that adrenal medulla produces a hormone. It used to be called one hormone. It's called adrenaline. And today it's called norepinephrine and epinephrine. And when we're in a fight-flight pattern, that system goes into rage. It triggers high levels of cortisol because it reacts that way and causes the adrenal system, the outer shell, to cause this inflammatory cascade. But it starts depleting dramatically an amino acid, which is a non-essential amino acid. What does that mean? It means that your body should make it, but under the situation, it's burning it up so quickly, we're not getting the nutrients that we need. And so it can't make it at the levels that it should be able to produce it. And I'm talking about something called tyrosine. And actually, if you looked it up, it's L-tyrosine. And tyrosine is an extraordinarily important amino acid, and it has an impact not only the adrenal cortex, but in the brain, and by the way, other areas of the body too that are extremely, extremely important. Your thyroid, by the way, needs tyrosine to produce thyroxine T4. And so does your adrenal cortex, and so does your pancreas, and it goes on. But guess what happens when you're in stress? When you're in stress, your body has to survive. It's in that fight-flight reaction. You're running away from the tiger that's going to eat you. And if you don't protect yourself, that running, that stress pattern continues, because you can't take that deep breath of air and go, okay, I'm good. But here's what really takes place. Now you're burning this tyrosine up, and because it has a lot of targets, and what we're talking about is the brain right now, tyrosine, and if you look it up as tyrosine kinase, it causes an autogenic reaction in the body, and it clears out these neurotoxic proteins, including your tau proteins and your microglials and so forth. And if it can do that, you stay pretty solid and your memory plane stays pretty on target. But when it can't do that, or when it's overwhelmed, or the body's going into fight flight, there's a lot of systems that shut down. You start seeing lack of energetics. You start seeing thyroid function problems. You start seeing blood sugar transport problems. But the most important piece is the slow, insidious breakdown, degradation of your ability to think through the process. And on the 14th, I promise you, I'm going to go into this in depth, but identifying what's going on and targeting, the therapeutic need for additional tyrosine. Now, here's the deal. What we're learning and what the literature, you go into National Institute of Health, and there's an article that talks about serum tyrosine associated with better cognition. And it talks about these Lewy antibodies and so forth that takes place. Amino acids are important in stimulating other pieces of the puzzle, like these neurotransmitters that we've talked about. And I know this sounds extremely, extremely, oh my God, I don't understand what's going on. Well, I'm going to make it very simple for you. I'm going to break it down and tell you exactly what this means and how it happens. So if we're in a constant state of any kind of stress, either stress due to pain that we're putting up with all the time, stress because of biochemical insult, what's that? Drugs that we take, the wrong type of dietary patterns, all of those things can cause significant issues long-term, because one of the things that takes place is it's not only eating up, meaning utilization of this L-tyrosine, but the body can't produce it fast enough. And there's specific levels based on what we find and your body weight and so forth and longevity of this thing. It's the impact. And if you look at the studies, they're talking about tyrosine being used anywhere therapeutically from about 2 grams up to 20 grams a day. And we'll talk about, if there's side effects and that type of situation. But what I want you to understand about tyrosine is that if that mechanism is problematic, meaning that you don't have enough of it, or if it's being burned up, you will go into a dementia. And it could be short-term dementia, where you start forgetting names, like a lot of us do as we get older. That can be straight up a stress pattern that's accumulated over a period of time. But here's the interesting thing. There was an interesting research article that was published back in 2021, actually in February 15th of 2021. And it was brain disease mechanisms. And the article was insights to the mechanism of tyrosine in preventing, guess what? Alzheimer's. And it caught me by surprise. I didn't realize that it was so impactful. And so I started reading through this thing. It's quite a long article with a tremendous amount of, research reference pathways. But it really got my attention, and it started tying some pieces together for me that I had not really considered before, and talking about the amyloid plaquing that occurs in Alzheimer's and so forth. Now, the the impact and the monitoring this is another piece. It's very significant, and we'll talk about that as well. But if you feel like reading through a scientific article, just look it up. Go to Frontiers in Molecular Neuroscience. That's where you're going to find it. And it's simply says, it's in the section of brain disease mechanisms. And the article, again, is insights into the mechanism of tyrosine nitration and preventing amyloid aggregation in Alzheimer's disease. So there's a lot of things out there that are being set aside because they come from the nutraceutical world, meaning the natural world, my place. And if it's not drug and they can't charge thousands and thousands of dollars for it, then they're not interested in putting it on the marketplace. The same thing that happened back in, when everything got shut down during COVID. There were tremendous amounts of other ways of treating, if you will, this craziness called COVID or SARS-CoV-2, and they set it aside because they couldn't put them on ventilators. They couldn't, with a death diagnosis of COVID, they got $40,000 per patient. So there was no incentive of using things like oleander and so forth that for $200, the patient was basically done. Or tying up the spike protein with N-acetylcysteine or things of that nature. So there's a lot of ways to fix things, but sometimes you don't get to see it. Because why? Because it doesn't put, the ka-ching in somebody's pocketbook. That's my opinion. And there's a lot of you out there will fight, tooth and nail because you don't want to be wrong about what you did. But here's the deal. Look, if there's an easy way to do it without exposing yourself to the onslaught of the side effects of some dangerous drugs, I'll give you something. I got a patient, and by the way, tyrosine has an impact on certain types of cancers. There's a patient that I'm treating right now, and she has multiple myeloma. It's a bone cancer. And she was telling me that the cost of her medication was $40,000 per month. That's what I said, $40,000 per month. So when you look at that and the shock value of that, does it work? The side effects are causing her some significant liver problems. Are there other ways to approach this, perhaps? At least conjointly, there's ways of supporting it. But here's what we've got. We've got a tyrosine mechanism that what you have to do is you have to figure out how to monitor it. You got to figure out the dosage of it. And at the end of the day, all the literature says that there's no major side effect. And all the studies that they've done, they can't find a major side effect to this tyrosine application. So if that's the case, why aren't we trying things of this nature first, recognizing, and you go through the literature, recognizing that the body eats up the substances that support fight-flight reaction, if we're stuck in fight-flight, very rapidly, and they lead to other types of conditions. There's another article in Scientific Reports, and this one is Neuropathological Characteristics of Lumer Tyrosine Kinase. It's called LMTK2 in Alzheimer's disease. So all of a sudden, we're starting to see this literature out there. But have you heard about it? Have you seen it? Has anybody told you about it? Not so much. But tyrosine has an impact in so many different systems. Did you know that tyrosine will restore pigment in the tissue? So people who have, all these crazy loss of pigments and, you're seeing these blotchiness all over the body. Well, that in conjunction with 2-3 other things, which we've used forever, will reverse it in the majority of conditions. Alzheimer's disease is this enigma that they're saying, oh my God, once you got it, you're done and you lose. Well, there's ways of re-stimulating brain function. And what you have to remember is the brain is extremely plastic. That means that it's remodelable, that even if you destroy some tissue, you can get the other portions of the brain to kick in and be able to take up for what the damage was done. And we know today that the brain continues to reproduce cells where years ago they said once, one and done, you're finished. Not so much. We know that to be different today. We know that, you can reprogram. We're seeing patients that if you're stimulated properly, that have had major strokes, over time, if you continue to work with them, you can get them to function back, but you have to do it in the right way. You have to find out what how to bring down the inflammatory reaction that was caused. You have to make sure that you're obviously balancing. If it was a blood clot to the brain, you have to be able to make sure that doesn't happen again. If it was a bleed, you have to make sure that you know how to repair it. But now you've got to re-educate the brain. And there's ways of doing that exponentially. And, we're missing the action. There's a patient of mine that had suffered a stroke and had lost the ability to move on the left side. And interesting enough, the speech was intact. And but the loss of gait, the left leg wasn't working, and on a brace and a cane and so forth. And I watch everybody walk because I want to see what their body does. And so what we did with this patient is we tested to see where the damage was. And we were starting to focus on the right side of the brain. So we played some music, chamber music, which is the normal rhythm of the brain. And we held it behind this person's head and within about 2 inches and had them walk again. Within 2 steps, this person walked better than they had worked since the stroke. And then we continued to rehabilitate them. We used some other process, and we actually added tyrosine. So there's ways of getting that back. There was a patient that we treated that had lost their ability to be able to form words because of a trauma, a blow to the back of the head. And we're able to identify which side of the brain, and we stimulate that, this time words with music. And we gave them tyrosine, and and with therapies and so forth, speech therapies, they would be able to begin initiating the formation of language, which they had lost. So when you start understanding the physiology, and that's what we're going to do on the 14th, we're going to take you through the physiological concepts of dementia. We're going to give you tools to do. We're going to show you what takes place. Pretty soon we lose our certainty about ourselves. One of the things that I do with patients is I'll have them hold a muscle nice and strong. We'll use an arm muscle if it's holding. And now it's not a strength test between me and the patient, because I can beat most of the patients in a strength test. But does the muscle lock or does the muscle not lock? And so what we do is I'll have the patient go into their subconscious and see what you say in an affirmation, in a certainty, that's your conscious mind. But sometimes your subconscious and your conscious mind don't agree. And until we clear that out, and there can be a confusion that occurs, and that that's one of the things we're going to talk about is brain fog, confusion, and there's reasons for that. But if we test a muscle and I have you say out loud, I like myself, and I test the muscle should stay strong if that's true, congruent for you inside and the subconscious level and outside on the conscious level. But a lot of people, when I have them say, I like myself, and I have them hold strong with that muscle response, all of a sudden the muscle weakens. And so I look at them and I said, yeah, not so much. And then there's ways of reestablishing that. But even, I love myself, I trust myself, I love myself, God forbid that you do, and you should, right? There's ways of determining it, but that all has to do with neurological aberrations, if you will, confusions, if you will, within the brain. So it goes to a different level. Some of us, don't think a whole lot of ourselves, and simply because there's a aberration from the subconscious mind to the conscious mind. And we're going to talk a little bit about that on the 14th. Problem is, I'd like to sit there and talk to you all night long and give you all these tools to be able to use. And I think you'd be surprised how effective things can be, but it's going to be a great time. So make sure you register. Remember that we have limited spacing. Go to drtomroselle.com. You can register right there, or you can go to rosellecare.com, and there'll be a big old sign. It says, brain fog, memory loss, and that's what you're going to do. You're going to click on. But this is an exciting time. It's an exciting time in the world, because in my world of healthcare and natural healthcare particularly, because we're starting to understand a lot more about what happens with how proteins in the body express themselves. And by the way, tyrosine is the matrix of protein, and the diverse applications they have within the brain function. Parkinson's, by the way, is a cerebellar problem, part of the brain, and it can be due to this, but it also causes, we know Parkinson's patients then begin to lose cognitive function, but not like Alzheimer's and not like old age dementia. But a lot of these things come together, and there's a common link between many of them. And that's one of the things that we want to discuss. This is going to be an exciting time, moving forward, not only on the 14th, but also it's an exciting time now in the world. And remember today, when I'm done with the program, we're going to go immediately into live stream. And you can, if you're following us on any of the social media sites, it'll let you know immediately, or simply go to drtomroselle.com and click on live stream, and you'll continue the program. And we're going to talk a little bit about the HPA axis today, hypothalamus pituitary adrenal. And by the way, which has a lot to do with what we're talking about right now with tyrosine. So we're going to kind of continue the discussion. And as you're listening to live stream, by the way, if you have a question that you want us to ask or answer and follow through with, you can type it into the chat bar. But you can now follow us anywhere. You can go to these, and they'll be on podcasts, they'll be on social media sites. We're doing this because you deserve to have the data. You deserve to make sure that you're educated at the level so you can actually be better educated than most of your physicians. And what I will encourage you to do is continue the process of learning. This is not difficult. I don't want you to learn the biochemical pathways. That's not what I'm asking you to do. I'm asking you to understand the concept and ask yourself the question, is this accurate? Is it true? Does it make sense to me? Where else can I find other information? Those of you who follow Joe Mercola, for the most part, I applaud, Dr. Mercola. He's got great stuff, and he's got a host of researchers that work with him. And, he's got a lot of references for his work. When you go into PubMed, the references are ongoing. So make sure that you do more homework. Just don't take my word for anything. Remember what I've said over the years is that my job is to provoke you. My job is to make you think differently than what you think. My job is to get you to go on and say, he's full of, hockey puck. And I want you to go look at it. If I'm not, that opened your eyes, didn't it? It made you think about something else. It made you look at the condition a little differently. So if we can do that together over a period of time, and on the 14th, we're going to do that. We're going to talk about these pathways and what you can do about them, and what happens when you have trauma, when you have blows, when you have injury, when you're not eating the way you're supposed to, when you're exposed to all these stupid chemicals that are in our environment, and how they begin to break down, and what happens when that stress pattern builds up over a period of time, and things like tyrosine no longer are available in the levels that they need to be, and what conditions and diseases to show up that are causing you dysfunction and distraught and fogginess and can't make a decision and things of that nature. It's critical that you know how to deal with yourself, because I'm telling you, and I'm promising you, over the next couple of years, you're going to see more and more suppression on media. You're going to tell you things that you're saying, really? And then you're going to run like a scared rabbit. You're going to go do it. We're coming up to the break in the program. Remember to follow me on live stream as soon as we're done, and we'll continue the conversation on things. Remember, I do this ongoingly and for one reason only. I love you all. I'll see you in a few minutes. Don't go away.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Brain Fog and Memory Loss on Wednesday, February 14th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com.